Hi guys, Dr. Nick here. So today we're going to continue our series on LDI, which is low dose immunotherapy. Today we're going to do some nomenclature. So we're going to talk about LDI nomenclature. So pretty simply, there's three main terms that we're going to talk about today, which is titration dose, core dose, and then of course our booster dose. So we'll start with the simple one, which is titration dose, so you can understand the scheduling of how the LDI kind of works. So like we possibly said in previous videos, you start with your first dose and then you get back to your practitioner, your doctor, within 7 to 10 days after that dose. Within that time frame, a reaction should have happened. So you should have either had a positive reaction, a neutral reaction, or possibly a negative reaction, which we're always trying to avoid. If one of those happen, so an example is if you get a neutral reaction where nothing happens in 7 to 10 days, that means that dose was not strong enough for you. So then we would go down to a stronger dose. So example, as we talked about before, with the different potencies, if you were starting at say yeast 25C, within a week, if no change occurred, we'd go down to 24C. And we continue to do that every 7 to 10 days based on any changes of your symptoms until we find something where there is a physical change in your symptoms, like we said, positive or negative, because then we know that we're getting close to your actual dose that you're responding to that will show the amelioration of your symptoms. So once we hit a response, like we said, we stop, we reassess the situation, and that's the whole point of titrating to a certain point where we can find something called your core dose. So the next one, core dose, what we're talking about there is that when we give you a certain dose at a certain potency of a certain LDI, you get a response, whatever that is. So maybe it could be 50% amelioration of your symptoms. Now we know that's your core dose, that it takes away always those symptoms in a sense. So once we find that through titration, then we consider that a core dose. And what we do is every 7 weeks is the earliest you want to give that core dose. However, again, if there's no worsening of symptoms within 7 weeks where our symptoms come back after you took your original core dose, say on day 1 you took your core dose and your symptoms have been great for the last, say, 12 weeks, then you wouldn't take anything at 7-week period, because the whole point is you have no symptoms. You wait until your symptoms come back, and then if they do come back to some degree, then you would go back and take your core dose, and that's what we know that would help. And again, that could change over time as your body adjusts and your immune system adjusts. That core dose could change where you might need a stronger one possibly, or a weaker one depending on the therapies that you might be doing. And then the last one here is we're talking about our booster doses. So sometimes when we're titrating, like we said, going to that dose towards that core dose, and we get a response, but it's not the greatest response that we wanted. Like say we wanted 100% amelioration of the symptoms, but we only got 30%, but we know there's more into it. So it's kind of like 30% betterment, and it only lasted maybe 7 days. Okay, so what we do then is that within that 7-week period, because we have a 7-week window that we can work within before we can redose any of those certain LDIs that you react to, positive or negative, what we can do is we can go back and give you something called a booster dose, which is something that's weaker than the dose that you're taking in order to kind of propagate another response. Okay, like we said, with the booster dose, what we're trying to say is that if there's a time within that 7 weeks where we're not getting the full benefit of that dose that first gave you some benefit, like we said, possibly 7 days or 3 days or 2 weeks or 3 weeks, and we want a little bit of a boost in your symptoms before we give you your core dose all over again, then we can kind of give you an example, a weaker dose of that physical LDI that helps you at that specific dose. So example would be if we were doing something of maybe your core dose was 23C of a yeast. What we could do is possibly give you 24C of the yeast, and that would be a 1% increase in the overall dose based on your 23C. I know the math, you gotta do some math there to figure that out. Or we can give you a 23.5C. If we give you 23.5C, that would be a 10% increase in your overall dose compared to your 23C. So it kind of depends on the situation. It kind of depends on where we're at in the cycle of giving the LDI, and it kind of depends on the patient in terms of what we want to do and how much benefit we think will happen. So, but that's the basics, like we said. So titration is we're trying to find the right dose, going towards the core dose. Once we find the core dose, we can give that every 7 weeks, or if betterment for longer than 7 weeks, we give it whenever necessary. And then when we're going towards our core dose and we get some betterment, but we're not get that full benefit that we wanted within that 7-week period, what we can do is we can give you a physical booster within that period. And again, the goal there is still to find the core dose, because we're saying that this dose that we gave you wasn't maybe strong enough to give you the maximal benefit with this. So 7 weeks later, what we're going to do is possibly give you a little bit stronger, or give you an increase of that physical dose. So from 4 units maybe to 5 units, which would then be 125% of the previous dose that you got. So 25% increase, which could make a drastic change in your amelioration of symptoms. So that's what we're going to talk about today overall. And next time we'll go into a little bit more detail of other parts of LDI. But hopefully I didn't complicate things for you, but I made it so clear that now you understand LDI in terms of the potencies and in terms of the physical dynamics of how we kind of dose, and now you understand the nomenclature, which is the most important part. But again, thanks for watching, and hope you enjoyed it, and continue to follow me for the new videos.